Okay, hello. Hi everyone. I'm Raudhah, hygienist at Dental Designs. So we come to another episode of Before and Beyond. And today I'll be presenting about two cases. It's pediatric patients. And the first case here, as you can see, it's actually a 5-year-old child that visited our clinic, and after a look on his teeth, and given the treatment plan I proposed to him, so the parents will be coming on the next visit for further checks and treatment. So what I firstly want to say and share about this case is, as we can see, in general, we can see all the baby teeth is present at the upper and the lower, and even when I do a clinical check, the back baby teeth is also present. But one significant finding is at the lower bottom teeth. The bottom teeth, there is two, not one, but two fused teeth. And what I mean by fused teeth, let me just circle it to show it to you. So these are the fused teeth. So in fact, this is actually a combination of the lower incisors with the lower lateral incisor in both lower left and lower right quadrant. Okay, and this is where the two teeth comes together, become united to form one big crown. And what's the significance of this? As you can see, there's a deeper groove on this fused teeth. Yeah, this deeper groove can actually potentially trap more food and can be an area where plaque can reside more easily, and higher chance and high risk for decay to happen. Fortunately for this child, I think she's keeping her teeth quite decently clean, especially at the lower fused teeth, but not near the gum line there, so she can actually improve cleaning around the gum area. As you can see, there's a little bit of brown plaque around the gum margins here. So so this can be removed by the normal home routine cleaning and brushing. And for her, this fused teeth may be a potential hindrance for the lower adult teeth to come out. So what I say is lower incisors. So for her future treatment plan, when she sees the dentist, it's good to get a check, get some x-rays to see whether the adult tooth is erupting. And if it's hindering the way, then doctor or the dentist can actually propose other treatment plans to help the patient remove the tooth easily. Okay, and then allow the adult teeth to come out at the proper position. Okay, and we also want to monitor whether there is potentially more fused teeth that might come out in the future. It may not be the case all the time, may or may not have a fused teeth in the future or in the adult too. But it's good for her to always see the dentist every 6 months to monitor the eruption of the adult teeth. Okay, and another significant finding I can see from this case is the top front teeth. Okay, as you can see at the top front teeth here, the top front teeth, there is a little stain at both the upper central incisors, and this is actually not stain or bacteria, but rather the start of a decay. And why is there decay there? It's because usually food comes into contact with the teeth first at the front teeth. So there's high chance for the front teeth to be decayed compared to the back teeth. So for this patient, there is a start of decay that area. And for her future treatment plan, it's best to see the dentist again to see how deep the decay is and whether or not a filling is required. Okay, and at the age of 5 years old, the adult teeth may not have erupted. So if the adult teeth is going to erupt soon, maybe in about 1 year or 2 years time, the child may not need to do a filling because the baby tooth will erupt and drop off to make way for the adult teeth. So it's a case by case basis. It's good to see the dentist, and when the dentist take a look, if the adult teeth is coming out, the kid may not need to do a filling. And if the adult teeth is not out yet and the decay is quite deep, it will be important to do a filling so that the decay doesn't progress further. Okay, and for this patient, oral hygiene wise, definitely you have to improve brushing around the gum margins. You can see here there's a lot of plaque there. Brushing near the gum margins will help to remove the bacteria and also prevent further decay progression at the lower front teeth here, as well as prevent food trap around the fused tooth where the deep grooves are. Okay, definitely a good cleaning every 6 months when she sees the dentist will help to remove the bacteria as well on top of her home routine care. And let me go to the second case. Okay, if you can see the second case here, it's also another 5-year-old patient that I see in the clinic. And for this case, we can see all the baby teeth are out. I don't see any decays when I check in his mouth. However, there are a lot of black and brown stains on the teeth. This is actually called chromogenic stains, and they appear mainly among pediatric or children, among children, but it could also happen for adult teeth. And what is caused by? It is caused by a bacteria that does produce a pigment, a black and brown pigment, more easily compared to other people. Okay, so they have bacteria that may cause these stains to appear a bit more prominent compared to other people, and also it's a greater need for the patient to keep a good oral hygiene to prevent these stains from building up further. Also, usually these stains can only be removed by the dentist or oral health therapist at the clinic. So for this patient, the proposed plan for him is to come back for his 6-month cleaning and then also get a checkup to make sure that his teeth is in good condition. Alright, so this will help to remove the stains. Good scaling will help to remove these stains and will keep his teeth clean and healthy as well. So that's for today's case, the 2 cases just now. And if you have any questions, you can always drop a message to us and we'll reply as soon as. Okay, bye-bye.